Hello there, and welcome to your head-to-toe physical assessment. My name is Calliope, and I'm going to be the nurse who is performing your examination. How are you doing today? I see. I hope by the time you leave this examination, you feel even just the littlest bit better. Now I'd like to start by asking you a few questions, and this is going to go along with our little miniature neurological examination. We want to make sure you are oriented to time, place, person, and situation. So if I could have you just confirm your name and date of birth. Wonderful. And is that your preferred name? How do you like to be addressed? Good. Now, would you mind telling me where we are at right now? The building or even the wing? Good. And what time is it approximately, or what time was your appointment at? And the date? Excellent. And what is it that we are doing today? Okay, wonderful. Physical assessment. Excellent. So from here, I am going to be looking at you from the very top of your head, looking at your scalp. We'll look at the eyes, ears, nose, throat, and mouth, the neck, the upper extremities, the chest, and the lower extremities. Now for this examination, I am going to need to be touching you. Is that okay with you? Do I have your consent to do that? Wonderful. So let's start by just taking a little look at your face. And I just want to make sure that the face has symmetry, that there's not one side that is perhaps drooping, that the eyebrows are intact. Okay. And I'm going to ask you to do a few different kind of funny motions, if you will. We're going to test your facial cranial nerve. If I could have you raise your eyebrows. Good. And can you close your eyes real tight? Good. I want you to keep them closed. I'm going to try to open them. I want you to resist me. Okay, good. And you can open your eyes. And if you could smile real big for me. Good. And if you could puff out your cheeks. Good. I'm going to try to push them in, and I want you to resist me. So keep them inflated. Okay, just keep the cheeks inflated. I'm just going to... Okay, excellent. And if you could try to frown for me. This one can be a little hard. Yes, tried it as well. It's kind of a strange thing to do on command. Yes. So that looks pretty good. You could do all of that. There wasn't any restriction in movement. Cranial nerve 7. Good. And I'm going to have a little feel of your scalp and the contours of your head. So this might feel almost like a massage. Perhaps a little more firmer than a massage necessarily. I want to feel the quality of the hair and make sure its strength is appropriate for its texture. I want to look for signs of alopecia. Just running my hands through the hair and seeing if I get, generally it's more than 10 strands. Good. Just taking a peek through here. And the other side. Okay, and even in the back here. That looks pretty good to me, okay? So I am going to just come in and palpate the temporal artery right in here. Feel that. Now, funnily enough, the temporal artery, the temporalis muscle, we'll be getting into. These are Latin words, and tempori is a word for time. So the temporalis muscle is the time muscle. It's funny how things get named. Now I'm going to be feeling the temporalis muscle, as well as the masseter muscle, or the chewing muscle. And I'm going to have you do a few movements for me. So the temporalis up here, I'm going to have you clench the jaw, unclench, clench, and unclench. Good. And with the masseter in here. I could have you clench the jaw, unclench, clench, and unclench. Good. Now I'm going to assess the temporomandibular joint in here. So as I'm feeling in here, you could just open the jaw and close. Open and close. Good. So that felt equal on both sides. Was there any pain in that? Any tenderness? No. Okay. You just give me a moment. Let's take a little peek at the sinuses. So we have the frontal sinus cavities, the ethmoid, and the maxillary along the maxilla, or that upper jawbone. So I'm going to be pressing in. Let me know if there's any pain or tenderness. All right. Just going to press, release, release, press, and release. Okay, so all good in the front. And press, release, press, release, press, release. Anything with that? Press, release, press, and release. How was that? Okay, so I'm going to do a bit of direct percussion, and I'm going to tap along these areas. And you just let me know if that is painful or tender at all. Okay? I'm just going to come in here and tap, 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 tap. Okay, do a bit of tap, tap, tap. Okay, and just like that. And how was all of that? Good. Okay. So let's go ahead and move on to the eyes, and I'm going to get up real close for a moment. And I'd like to look at each eye individually. And we're looking at the tissues around the eye, the tear ducts. We'll look at the conjunctiva. I'd like to look at the sclera as well. The iris and the pupil, of course. Good. And have you had any issues with the eyes as of late? Any itching, watering, redness, yellowness, vision changes, anything like that? No. Good. And eyelashes are evenly distributed. Now I am going to be lifting the eyelids up, and I'd like you to look down. I'm going to pull up, you look down. Good, and now I'm going to pull down and you look up. Down, you look up. Good, okay. The sclera is pretty clear, nice bright white, and the irises and pupils look clear as well. Good pink tissues. Now, you mentioned you haven't had any issues with your vision, right? So visual acuity has been normal. You haven't had any problems with reading signs or reading things up close? No. Okay. So then we'll move on to cranial nerves 3, 4, and 6. And I'm going to bring in a light. Now this might be a little bright. So first, I'd just like to check the pupillary reaction and make sure that everything is equal, round, and reactive to the light. And then we'll do our cranial nerve testing. Just going to come in at an oblique angle here. Here we go. Good. Just like that. Wonderful. Now, I am going to have you follow this light for me, and we're going to test your cardinal directions of gaze and make sure that your eyes are moving in every direction without any restriction or delay. So if I could have you follow this light using only your eyes, I want to isolate the eyes and without moving the head. Okay, let's go to the side. We'll check each side. Let me know if it becomes difficult to move in a certain way. Good, and let's go up and down. So we'll go up can check for any lid lag here. Back up and down. Good. Okay. And let's try a few diagonals. So let's move diagonally up. Good. Diagonally up. And diagonally down. Diagonally down. Good. Diagonally up. Diagonally up. Good. Diagonally down. Diagonally down. Wonderful. Now keep your eyes focused on this, and we're going to test how your eyes react to distance, okay? So look at this. And now if you could look at the wall behind me here. Good. Look at the light. And look at the wall behind me. Okay, look at the light. Look at the flowers behind me here. Look at the light. And look at the flowers. Wonderful. Come back to the light, and we're going to test coming in and out this sort of smooth motion, right? So we'll come in and out. Wonderful. In and out. In and out. Wonderful. That all looks great. Now if you'd like to blink the eyes a bit and give them a rest for a moment. There's quite a lot of working out those little rectus muscles behind the eyes, those little straight muscles. And we'll move on to take a little peek at the ears. So I'm going to grab a speculum, and then we're going to do our inspection and our otoscopy. Go. Now, have you had any issues with the ears themselves, the ear canals, any itching, burning, redness, pain? No. And what about hearing? How has hearing been? Okay, good. All right, so let's take a little peek. Let's take a little peek right over here. And just look at the ears. Okay, and the pinna is in good condition. And looks like the back of the ear is clear as well. And the other side. Good proportional ears. Okay, and back of the ears where one might find lesions quite frequently. Or other signs of skin conditions. It's not somewhere we can see on our own. Good. Okay. And let's take a peek inside the ears if you don't mind. So I'm going to have you stay still, but if you do happen to move, I'm going to have my finger right along your face so I don't accidentally jab you, right? Just be as still as you can so that we can take a good look into the ear. Now, do you happen to notice perhaps that you produce either what you would consider maybe an excess or perhaps even not enough of cerumen at all? No. Okay. And do you use cotton buds in the ears? Okay, we want to keep those out. Those can lead to impaction in the ear, and we do not want that. It can cause temporary or permanent hearing loss, at the very least. Good. Okay. Good. Let's bring that to the other side, pulling up and back on the helix there. And then we can look inside of the ear. We can note the tympanic membrane and all its landmarks. Make sure the ear canal is clean, free from impaction. The membrane doesn't have perforation. Good. Okay. That all looks pretty good. Right. And I would like to just test the hearing a little bit. I do believe you. I just want to make sure. So I am going to whisper some words in the ears, and I just want you to tell me what they are. Okay. 18, 50, 4, 100, 99. Good. 7, 41, 68, 25, 0. Very good. Okay. Loud and clear. So, cranial nerve number 8 is doing all right. And we'll move on to the nose. We'll take a little look. We'll look inside and jump all the way back to cranial nerve number 1. So, have you had any issues with pain or perhaps congestion? Any issues breathing, snoring with the nose? No. So let's just take the speculum off. And if you could just lift your head a bit, and we'll take a little peek inside the nose so I can look at the tissues, and I can get a little bit of a look at the turbinates, but I want to make sure that septum is midline and there is no perforation. Okay, that looks good. Alright, now for cranial nerve number 1, our olfactory nerve, I'm going to put a bit of liquid on a cotton ball, and I just want you to tell me what that smells like. That should be enough. Okay, So I'm just going to hold this under the nose. Let me know what that smells like. Yes, very good. That is absolutely isopropyl alcohol. Now lastly with the nose, I want to make sure that each passage is breathing correctly. So I'm going to cover one side. I'm just going to have you take a few breaths. And let me know if there's any difficulty with that. No, all clear. Okay, and the other side. Good. Now I'm actually going to bring our little smell ball back, and let me know when you smell that. Okay, and the other side here. Can you smell that? And is the ability to smell that equal on both sides? Yes, okay. Now we're going to check a few more cranial nerves with the mouth and the throat. So first, if I could have you stick out your tongue for me. We're going to test the last cranial nerve, the hypoglossal nerve. And I'm just going to have you move your tongue up and down and to the side and to the other side. Wonderful. Now if I could have you open your mouth, we'll take a peek. Can you lift your tongue to the roof of your mouth? Good. Alright, that looks good. Color's good. Tissues are good. And you can go ahead and put your tongue down. And I want to look at the teeth real quick. Just make sure there's no signs of decay. Right, and I'm going to have you stick out your tongue. Good, I'm just going to look at the throat wall. And see, we can see the tonsils. Okay, and uvula is midline. I'm going to have you say ah for me. Good. Very good. Good response there. So lastly, for our glossopharyngeal and vagus nerves, if I could have you take a dry swallow for me. Okay, just try to, even just a small one. Good. And was there any problem with that? Any problem trying to convince your throat to swallow or anything like that? Any sticking? No. Okay. All right. So, little basic test for the vagus nerve looks good. Vagus nerve does a whole lot. Excellent. And let's go ahead and take a look at the neck. So, just want to look at the trachea in here. I'm going to be very gentle about this. This is a very vulnerable spot. Good. Okay. And I am going to have you real quick just recline back. And then if I could have you turn your head to your left. And we're going to look at the jugular vein and look for any jugular venous distension there. Look at the pressure. If I could just have you just lie there for a moment. Okay. And I am going to press down on your liver area. Is there any pain in the liver area? Okay. Any pain in the stomach? No? Okay. So I'm going to press firmly down and I'm going to watch that jugular vein. And then come back and we're looking for a hepatojugular reflux. Okay, and that looks good. So if you want to come back up to sitting, and now I'm going to take a little listen to the carotid artery. And then as long as that checks out, then we can do a bit of palpation. So I'm going to listen one side at a time. And I'd like you to just take a deep breath in and hold it so that I can isolate those sounds in the carotid artery. Good, and you can exhale. And deep breath in. Hold that. We're listening for any bruits or audible heart murmurs. And exhale. Okay, I'm just going to pop this to the side for a moment. We'll be coming back quite shortly. Now I'm going to do some palpation in here. So I'll do it one side at a time rather, as this is another area that feels a little vulnerable. The other side. Got a good strength to that pulse. Okay. Now lastly, before moving on from the neck, I'd like to palpate the lymph nodes. I'm going to start in the back at the occipital nodes. This is in the area of the occiput, which is around your hairline. It's where the head meets the neck. And then we'll come forward to the post-auricular nodes, which are behind the ears. And in front to the pre-auricular nodes in front of the ears. And the submental and submandibular nodes right under the jaw here. And down the neck with superficial cervical, deep cervical chain, posterior cervical. And finally at the bottom we have supraclavicular above the clavicle. Here we go. Good. Okay. Neck is all clear. Very good. And now we will move to the upper extremities. So I'm going to have a little look first. And you haven't had any problems with pain, muscle weakness, coordination, skin changes, anything like that? And what about joint pain? Okay, so shoulder, elbow, wrist, and fingers. Those have all been all right? Good. So let's palpate some pulses. I'm going to get your radial pulse, your ulnar pulse, and your brachial pulse. All right? So I'm just going to do this on one arm. And then we'll test for a radial delay, rather. And that involves both arms. We'll feel the ulnar pulse. There we go. And brachial pulse can be a bit of a tricky one. Not so much as the popliteal pulse. That one likes to hide quite a bit. Good. Now I'm going to palpate both radial pulses at the same time. They should be synchronized, but if there's something kind of goofy, then they might not be. So I'm just going to palpate both pulses. And we'll just get a good amount of beats in there to make sure they're fairly synchronized. Very good. All right. And let's check the fingers for a few different things. So I'm going to look at capillary refill and just press the finger and watch for everything to pink back up. Make sure the circulation is nice and quick for you. Just going to press each finger. And got a real quick response to that, so that's good. Now for a very informal, simple test, I can check a little bit of your dehydration levels. So my skin here, as I'm pinching it, bounces right back. Now sometimes, if you are quite dehydrated, that skin will take a little bit to go back down. I'm just going to pinch and release the skin on your hands. Okay, and that comes back down real quick. All right. And then we'll just take a peek at the fingers, at the joints. Make sure there is not any pain, that there aren't any changes to the nails, that there's not any palmar thickening, for example, wasting in the muscles here. We'll just do some palpation. And let me know if any of this is painful at all. Okay. Oh, good muscle development with the thenar and hypothenar areas. Skin looks good. And if I could just have you show me your elbows, I can look for any scaling. Might be indicative of psoriatic arthritis. Okay, and that looks good, right? So I'm going to have you do some different muscle tests and some range of movement testing. So if I could have you squeeze my fingers. I'm going to just hold out my fingers here. If you could squeeze them as hard as you can. Very good. Okay. And if I could have you move the wrists up, down, in, and out. Okay, and if you could give them a little bit of a turn, get a lot of cracking in there. Okay, and I'm going to have you hold up your arms like this so that your forearms are perpendicular to your upper arms and your shoulders. And I'm going to try to pull you towards me, and I want you to resist me. Good. And I'm going to try to push you, and I'd like you to resist me. Very good. And if you could just move the elbows a couple of times up and down. Okay. Can you tuck your arms at your sides so your elbows are right at the rib cage, and move the arms in and out? So rotate the elbows there. Good. And could you roll the shoulders forward and back? Good. And lastly, I'm going to test the accessory nerve, and I am going to have you just shrug a couple of times. Okay, and I am going to press down on your shoulders. I want you to shrug up against me. Good, and I'm going to have you keep them up. I'm going to try to push down, and I want you to resist me. Very good, okay. So let's go ahead and move on to the chest then. This is where we bring in the stethoscope again. And I'm just going to have a little peek, and I'm going to feel the pulses here, or feel the heart rather. So there's a couple different positions here, and I can feel with either the heel of my hand or the flats of my fingers, and we can feel for heaves and thrills, and these are palpable heart murmurs. Okay, and then we can bring in the stethoscope, and I'm going to start with the heart, so you're more than welcome to breathe normally. And I'm going to start with the aortic area. Good. Okay, and around the pulmonary valve here. Good. Tricuspid. Okay, and then the mitral valve. Good. We've got some good sounds there. Those beating sounds you hear are from those valves opening and closing. They're quite loud if you really think about it. Okay, now for the lungs, I'm going to direct you when to breathe and how to breathe. So if I could just have you take a deep breath in and out. 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 last one. Deep breath in and out. Good. Good lung capacity there. Sounded real nice. So I'm going to move to the abdomen. We're going to auscultate first. If I start pressing into things, we will get kind of a distortion of sounds that wouldn't be there had I not palpated. So if I could just have you breathe normally. And we're just going to feel around a bit. Or listen around a bit, rather. We're avoiding the feeling beforehand. Okay. And we'll put this down for the examination. Now I'm going to do some firm and deep palpation in the abdomen. So for the firm, I'm just going to use one hand. Feel around the organs. And if you could just let me know if something is painful or tender. Okay, and for the deep pressure, I'm going to use both hands. And this one might be a little uncomfortable. But the trick to this one is to just keep breathing through it. It's a little hard when someone's pushing their weight into your abdomen. But I'm almost done. Good. And that is that. So now we're going to move to the lower extremities. Now, I am just going to have a little look. We can often find some skin issues indicative of other conditions on the shins, for example. And if we feel around the ankles, you can feel for fluid retention, or what I'm looking for is more of a pitting edema. So if I press in and release, is there still that impression in the skin? And we do not want that at all. We'll feel around the ankles. Good. And then let's do some pulses here. So with the popliteal pulse behind the knee, to isolate it, you can bend the leg a bit, use both hands. And even then, sometimes it can't be felt, but we're going to check anyway. So when you do get that pulse, there's almost like a little aha moment. It's a small sort of accomplishment, really. Good. And then I'm going to feel the post-tib and dorsalis pedis pulses. Good, and let's check the capillary refill on the toes. And then we'll do some range of movement and strength testing. Okay, that looks good. So I am going to try to push your toes down, and I want you to resist me. Okay. I'm going to try to lift the toes up, and I want you to resist me. Good. Now, if I could have you turn the ankles in, out, if you could go up and down with the foot, and if you could roll the ankles front and back, forward and backward rather. Very good. I am going to press against the shins. I want you to resist me. Okay, and I'm going to try to pull them towards me. I want you to resist me. Okay, and can you kick out your knees? Going up and down. Okay, I'm going to put my hands on top of your thighs. I'm going to press down. I want you to press up against me. Good, and I'm going to hook my hands underneath. I'm going to try to pull you up. I want you to press down and resist me. Okay, and lastly, if you could turn each leg outwards. So right at the hip, if you could bring your leg right from straight in front of you and turn each one out from the hip. Good. Okay. And how was all of that? All right. No pain, no feeling a restriction in movement? No. Very good. Very last thing. I'm going to bring out the Chomner hammer, and we're going to start with the Achilles tendon or ankle jerk reflex. So I'm going to hold on to the top of your foot and the very front. We're going to pull just a little bit of tension here. And I'm going to tap at the back of your ankle. Okay, and the other side, we'll get a bit of tension with the foot, and very good, watching those muscles. Now the patellar reflex, this is our knee jerk, and a fun fact about the patella, another little goofy thing about Latin, the word patella is plate in Latin, as in a dinner plate. So if I could have you relax the leg, and then we'll do a few good taps. Very good. Lastly, for the upper extremities, we have triceps, biceps, brachioradialis. All right. So I'm going to start with the biceps here. I'm going to put my thumb in the crook of your elbow and wrap my hand around. And I'm going to tap on my thumb here. We're going to watch that muscle. Good. We get some good movement there. The other side, thumb goes in the crook of the elbow, hand goes around the elbow. Very good. Now I'm going to hold the arm here, and we'll get the back of the arm. This will be the triceps reflex. Good. The other side. There we go. And lastly, I'm going to just grab the brachioradialis one here. So if you could just let your arm go limp. And we're just going to come. It's going to be more towards the wrist than the elbow here. Good. There's a lot of places you can elicit this one. Good. Okay. And that will about do it. Good. Now, did you have any questions for me at all? Okay, excellent. So let me sign off. And that will conclude our head-to-toe physical assessment. Now, your results were wonderful. You are in the pinnacle of health, and I'd like to thank you so much for your participation. I hope you have a whale of a day and a good rest of your night. Thank you.
Thank you so much for watching. I really appreciate it. If you enjoyed this video, it would greatly help me out if you clicked the like button and left a comment so YouTube's algorithm registers that it was a good video. If you want to see more of my work, consider subscribing to the channel. I create primarily medical, pseudoscience / alternative medicine, and personal attention ASMR roleplays. But I've done a little bit of everything from historical to sci-fi to fantasy. If you'd like to support the channel, I offer ad-free videos, early access on videos, and exclusive content on Patreon. Or I also have a Ko-Fi link for a one-time donation, or a throne wish list for props and equipment. Thank you again, and I hope you have a whale of a day and a good rest of your night.